All right, so again, I'm Olivia McClellan. I'm the Principal Manager of Behavioral Health for Lane County. I oversee all of the programs and services that Lane County provides, mental health services that Lane County provides internally. So we're going to talk a little bit today about our newest program, which is Mobile Crisis Services. It has a fancy title, Mobile Crisis Services of Lane County, but we just call it MCS. So that's what you'll hear us refer to as. I think the next one. So a little bit about our program. Some of you may have seen these slides because I know when we first got going, there was a presentation that was done. So some of this may be old information for you, but if not, so Mobile Crisis Services, our job is to address the immediate needs of individuals who are in crisis, that are experiencing an active mental health or behavioral health crisis. All of our services are delivered in person with teams of providers, teams of 2 that ride on vans in our community. That go anywhere across Lane County, all 4,445 square miles we respond to. Again, our job is to de-escalate and stabilize. That's the primary goal when we attend these calls. Like I said, our teams are on fancy vans that have wonderful resources located in them. We have technology that's really wonderful in our vans that allows us to communicate and keep our staff safe and the folks we're serving safe. We have the ability to print resources, to have handouts, to help people in that immediate moment, look for resources online as we're out in the community, as well as safely transport people in a warm, safe, secure van to wherever they might need to go in terms of a higher level of care. We have a 100% zero refusal rate. So we will see and provide care for anybody that reaches out to us. Care looks like a variety of things, and we'll talk about that a little bit later. But if we're called, we'll come. So that's really how we provide care. And there's no wrong way to get to us. So there's several. You can call 911. You can call 988. You can call non-emergency dispatch. You can call the crisis line. So there's lots of ways that you can get to us. And like I said, no wrong door. So a little bit about the program. So Mobile Crisis Services are provided per the Oregon Health Authority. So there's federal legislation that Oregon Health Authority monitors in the statewide to ensure that mobile crisis services are provided across the entire state. Lane County Behavioral Health is the community mental health, the local authority, mental health authority, or the community mental health provider for our county. So we're obligated to either provide that service or ensure that service is provided in our community. So we took this as an opportunity when this funding came up to expand the small services that were being offered very locally in the Eugene area to the entire county. So this is our service map in terms of where we provide services to. So all of these areas here that are in green, these are our metro areas. So we respond in that area. We have to respond within 1 hour to services. We attempt to do it. And our response times are really solid. So we've been really lucky to be able to maintain those. All of the brown areas are the rural areas, and we have a 2-hour response time per state statute. And then these red areas on either side are considered frontier areas. So we have up to 3 hours to get to those communities to provide services. The one unique thing about this map is although Lane County is obligated to provide the service, we actually subcontract that #1 area out to Western Lane Fire in emergency response in Florence. They had actually, prior to COVID, we had received some grant funding, and that community had talked about needing crisis services available to their community. And so in partnership with Lane County, they created their own crisis response team that was built with volunteers to ensure that their community was safe. And so as we received this funding, they raised their hand and said, hey, we would like to continue providing the service for our community. And we said, you've been doing a great job, let's keep up that work. And so we subcontract the work that's done from in that area to Wolfia. So, but the rest of it is all us that's being provided out of right here in Eugene Springfield. So our general services provided, we do, the basics, de-escalation, crisis services, safety planning. We work to help folks connect with mental health practitioners. That could be our folks who are on the van providing that service most immediately, and or connecting them to other folks in the community, either immediately, so taking them to the hospital, taking them to detox, taking them to other resources that they may be already connected to, but maybe can't get to on their own. We work with Riverview. So Riverview is, we subcontract all of our youth service work to them. So they provide for the entire county, they provide mental health services for youth, from little tiny folks who might need a mental health crisis all the way up to people who are in what we call transition age. So that's that 18 to 22. And so folks who fall in that 18 to 22 age range, we sort of, when the calls come in and we get the information, we do we sort of assess what's going on. We can look in our records to see if we've served them or if they've perhaps been served by Riverview previously. And then we can ensure, hopefully, that the right organization is connecting. So if maybe there's somebody who would benefit more from a youth perspective, then we try to get Riverview to them. If there's somebody who's more on the adult side and would benefit from adult support, then we go out. So there's that sort of in-between ages that we both support. Let's see. We're constantly looking for new resources to support folks that we're seeing as the world gets a little bit more tumultuous on a daily basis. We're continuing looking at broadening the resources that are available to our community, local community organizations like this who might be providing services within their own community. We're trying to connect as much as we can so that we have good resources when the folks are calling. We can coordinate with existing providers. So if we're calling, during the 9 to 5 hours, if you have a therapist and you give us the authority, we can try to connect with them and let them know that we've seen you, we've taken you to the hospital, or we've taken you somewhere. So we really try to work with communities, with our communities, service providers that are already providing that care to ensure that we can sort of wrap around folks. Let's see, we can do some direct referrals to behavioral health care. We do transportation coordination. So I'm really careful when I talk about when we do transportation. So mobile crisis can transfer folks to higher levels of care. So if we meet somebody who's on the street and they need to get to the hospital and they're willing to go with us in the van, we can safely transport them to the hospital. If we meet somebody on the street and they want to go hang out with their friend Bob who lives a neighborhood over, we don't do that transport. But alternatively, if we are talking to somebody and they're like, my mom lives in Bonita, she says that I can come there and be safe, and she's a trusted person, we get on the phone with mom, we can confirm that, yep, this is a safe place, we can drop this person there safely. We will do that level of transport for folks. So again, we're really focused on getting people to a level of care, not just giving rides around town. We do non-voluntary, voluntary non-secure transport. So that's what I was just talking about. We offer director's custody as a part of the service that we are able to provide to the community. And we'll talk at the very end a little bit about what a director's custody is. And essentially just the quick of it is that if somebody is in such distress that they are causing themselves harm or potentially causing harm to others, we have what's called director's designee status, where we can determine that somebody's unsafe and we can work partner with law enforcement to get them safely transported from wherever the location is to the hospital. And these are folks who don't want to go voluntarily, but we've determined that they are a risk such that they need to be transported for further evaluation. So we do provide that as a part of what we do. We follow up within 72 hours. So with everybody that we serve, we attempt to make contact with them within 72 hours if they consent to it and if they have a means in which we can connect. And we also sometimes with our unhoused folks, we will say, hey, they'll say, well, I don't have a phone, you can't reach me. Well, can we come back out and see you in a couple of days and check and see how you're doing? And if they say yes, then as time permits, we go out and try to connect directly. So we're really trying to make sure that there's some follow-up and positively. And then lastly, we do have naloxone on our vans, and we do administration, but it is not a primary service. So we remind the community that if you see somebody that you observe that you think is actively in an overdose, don't call mobile crisis. because we want emergency services to get to that person, provide emergency care, assess, and then potentially get somebody to the hospital, because naloxone only lasts for a small amount of time. So we really want to get them to the care that's most relevant to what they're currently experiencing. However, if we're on a call and somebody tells us, I've just taken fentanyl, or they're starting to nod, or whatever we're observing, we can provide that and do. All right. So there's a variety of reasons. I'm not going to read through them all that folks call us. Our number one is certainly folks that are agitated or having disruptive behavior. I would say a good 50% of our calls are community members that are witnessing somebody in the community that they're concerned are experiencing some sort of behavioral health crisis, and call on the behalf of that person and request that we come out and check. And we do that. And sometimes it's a neighbor, and sometimes they know the person that they're calling about, and sometimes it's somebody that's a passerby that's going down the street and they observe something and they want us to come out and give it a check. And we do those all as well. Then there's, everyone else on here. I think that the interesting thing about the work is I think when we started mobile crisis, I think what we thought we were going to see and who we were going to serve looks a little bit differently than where we've landed. So I think everybody was really hyper-focused on our unhoused community and our folks who are struggling with substance use disorder. That's who everybody thought, that's who we're going to see the most of. And while we do see a good portion of those folks, we see a lot of folks that are housed, who are safe, who have health insurance, who are employed, who have family and supports around them, and are still in crisis. So that's the beautiful thing about the work that we do, is that there's no one, it doesn't look one way. Who we serve doesn't look one way. And I appreciate that. And we're now, because we expanded outside of the Eugene area, we're going to, yesterday morning, we went to Oak Ridge. I got up and we got to drive out to Oak Ridge at 6 o'clock in the morning to check on somebody who a neighbor was concerned about. We go up to Blue River relatively frequently. We're down in Cottage Grove a lot, more than we're in Springfield, frankly. Although when we get to the stats, you'll see the majority of our services are provided in the Eugene area. And I think that's just because we're more attuned to a resource that existed previously. And so the rest of our community is sort of catching up and understanding that we are available and we can come and be there. It's really hard. It's fun. So we launched our pilot launched in August of 2024. So we just experienced our first anniversary. So that was pretty exciting for us. We have a fleet of 6 vans. One of our vans has a lift on the back, so we can work with folks who might need some additional support if they have a mobility device. We're currently continuing to hire for our mental health associate positions. It was Whitebird, and so I don't know what Whitebird's plans are for.
I think they broke away from Whitebird, so that's all.
Yeah, that's as good as mine. We have so much that we're doing that's where our primary focus has been, is just making sure that we're doing what we're doing really well.
Sure.
Oh, you okay?
So the director's custody thing. So you make the decision, then law enforcement comes in and forcibly.
Yep.
Okay.
That's the way, it's a statute, a state statute. So it's how it is executed, is that law enforcement, because you're suspending somebody's civil rights. You're saying you are not safe right now. We're suspending your civil rights, and we are going to transport you somewhere, a secured location where you can be evaluated. And in the hospital, once you get somebody to the hospital, there's another level. So my director's custody suspends somebody's rights merely for transportation. So it doesn't do anything beyond that. Once they're delivered to the hospital, then the hospital does an evaluation, which is called a notice of mental illness, that will say this person needs to stay in the hospital and be evaluated for a few days. And so they have 5 judicial days in which to determine either to help that person get restabilized. Sometimes people can stabilize in a couple of days. They get some medication in them, they rest, they're able to, have some of their basic needs cared for, and they're able to stabilize and go back out in the community. Sometimes that's not the case. Sometimes they need to be living there longer. But in 5 days, we have to make a case. So we have a different department that's not related to mobile crisis, which is our civil commitment team. and they do an investigation, which is working with family members, friends, providers, if people have providers in the community, the hospital who's observing and providing care. They create a report, which is presented to the court, and the judge ultimately determines if somebody is placed on a civil commitment. So there's a whole other process separate from the director's custody. But the director's custody is the tool that we have available to us to get people safely transported to the hospital for further evaluation. Okay.
My question was the same as hers. I heard of at least a couple of other mobile crisis response groups. One did recently spin off, I think, from Whitebird and more Cahoots. I saw them picturing in a local newsletter just last week. So my question was, to what extent are you, interlaced or overlapped with those other service providers?
Sure. So currently, the only other mental health or mobile crisis teams in our county are the team out of Lufia, so out of the team on the coast in Florence, Riverview, and us. Those are the only three. And Cahoots, they have a contract with the city of Springfield for, I think they're 11 to 11, 5 days a week, something like that. So there's one Cahoots van that runs in Springfield during those times. But other than that, there aren't any other mobile crisis service providers currently acting in our community.
That's definitely not true. I mean, there's tips.
That's not mobile crisis services. So it's a great program. We partner with them, but they are not mobile crisis services. Yeah,
Okay.
No, but they're awesome. Yeah, we partner with them a lot. So the TIP is the Trauma Intervention Project. And so those are folks who are volunteers in the community that work and go out and respond to crisis, but they do long-term. So they go out and do long-term care. So it's almost like ongoing case management with somebody who's experienced a crisis. So if your house burns down, or your partner dies, and so that they do sort of a different type of work than what we're doing. So we're doing emergent crisis response.
Okay, thank you. Sorry.
Yeah, no, appreciate it.
So you mentioned this group Riverview. Is that like a corporation that does this, or is that we don't know anything about them? Who are they?
Sure. So Riverview used to be the Child Center. It had a longer name than that, but they've been in the community for 30 plus years. They're located over in Springfield. They do residential, they do outpatient, and then they do crisis. And they've been doing crisis response prior to federal legislative mobile crisis services. And so when that funding came through, again, the county said, who would like to provide that service? They said, we're already providing that service. We would love to provide that service for the youth. So we fund them to provide it. They already have it built in to the service that they've been providing. But they had a name change about 2 years ago.
Yeah, so it's Riverview Center for Growth. It's their whole new name.
Yeah.
Yeah.
When you're hiring for your teams, what kind of qualifications do you look for?
Oh, great question. So all of our providers that are on the vans are qualified mental health associates. So that is a certification that's done through the state of Oregon that requires, you can get it in a couple ways. So you can get it as a bachelor's degree in very specific mental health degrees, psychology, nursing. There's a couple of other degrees that qualify for it. So if you have that 4-year degree, you can get certified to become a qualified mental health associate, or if you have years of experience. And so that years of experience have to be observed by somebody who has a clinical degree and has the authority to say, Bob has done 3,500 hours of work, case management work. And so then you have somebody who attests to the different skill sets, and then those folks receive that certification. So at bare minimum, our folks have to have that QMHA certification to be on our teams. Who we have former firefighters, we have, right now we have a former police officer, we have folks who have worked in youth services, we have folks that have worked at several of our secure residential treatment facilities, working with our folks who have severe and persistent mental illness, so multiple years of experience doing that. Then our supervisors are all qualified mental health professionals. So those are folks, again, with a master's degree in mental health. And then our supervisors, we at the county require our behavioral health supervisors to have their license. So all of us are either licensed clinical social workers, licensed professional counselors, licensed marriage and family therapist, a licensed psychologist. So those are the folks who are providing that higher level of support to the team. And we go out on vans too. So like I said, tomorrow morning, I'll be out there at 6 a.m. riding on our van, providing care. Let's see what we have. Yeah.
Two questions.
Sure.
One would be, I mean, obviously there's the federal funding side, but again, this costs money to run a program like this. So, do you bill insurance for those who you serve when you can, and how does that work? That's the first question. And the second question would be, how staffed are you, and how staffed would you like to be? I mean, is there a percentage that you can give us, or that sort of thing?
So for the insurance question, we serve anybody, insured, uninsured, it doesn't matter. When we are out on a call, we will attempt to gather information that will allow us to bill health insurance. There are protocols, so you have to be, there's also a amount of time you have to be with somebody in order to bill for that service. So we have to, not only do they have to have health insurance, but we also have to meet the threshold, which in most of our calls, it's 8 minutes is the base threshold. So in most of our calls, we're able to easily meet an 8-minute service time. So yes, we do try to, because any opportunity to capture insurance is important. We get some payment through our CCOs. A significant portion of our money comes through CCOs, and then obviously federal funds that funnel through the states. OHA pays for a portion of what we do. So that's how we're currently balanced. How that looks in a month, 6 months, that, you know, it really depends on what happens at the federal level, the state level. There's lots of unknowns right now. We know that we are secure. We have funding, we know, to secure ourselves through the end of this fiscal year. So that would be until the end of June 2026. That is the money we know we have in the bank. After that, it depends on what our funding cycle is. So second question. Staffing. Oh yes, staffing. Ooh, that's my life. So right now, like I said, we've done the staggered start. So we've had 10 folks on, and the total of our team, as it is funded through the amount of funding that we get from the state, is enough to have a team of 20 people. So we were at 10. We have 5 people starting this month. So we're really excited. We have 3 people starting on the 13th, 13th, I think is the Monday. And then we have another 2 people that are starting at the end of the month on the 27th. So it takes about 6 weeks of onboarding to get folks. They all come with great skill. They've all done crisis work before in some way, shape, or form, but to get them acclimated to county services, how we have to provide, there's a certain level of training we're obligated to provide for this. Lots of things that happen in those first 6 weeks. We do a lot of shadow writing. So they're writing with teams that are already out there so that they can observe. Then we switch them and put them in, we use a contact and cover model. So one of the people that's out is the contact. So they make the initial contact, they have conversations, then the other person's the cover. So they're making sure that the scene is safe. They're observing anything going on. They're communicating. We have dispatch radios, so they're communicating back to dispatch if there's information that needs to come back. So we use that model. So as we're bringing new people on, they get to shadow, they get to be like the third wheel to that and observe for a couple of weeks. Then they practice being in each one of those roles before they're sent out with a partner. And all of our folks, we match them with an experienced person. So it's not 2 newbies going out together. We put them with somebody who's been doing the work. So we have, after that, the rest of the folks that we have to hire are overnight folks. And so we have to get an overnight supervisor before we can expand that team. So it's like this delicate balance. You have to hire a supervisor, but you need the people, but then you need the people to make the supervisor. So it's a little challenging, but we have about 5 more people.
And as far as the call center goes, like, what does that look like? Are the same people that are riding in vans also taking the calls?
No, they're not. So our call services, we have that subcontracted as well. So we have a service that answers all of our calls and then dispatches that information. So the calls that you call through the crisis line, the crisis line tries to mitigate whatever's happening first. So if they can have a conversation with whoever's on the phone and they can mitigate the crisis that's occurring via telephone, that's what we try to do first. If not, and it becomes determined that we need to have mobile crisis respond, then they send that information to the sheriff's office dispatch. So they have a backline to them. They call dispatch. They let dispatch know mobile crisis needs to go to this address. Here's the information. This is the information we know from having talked to the person. And then dispatch sends us out. And so we, like when you see police officers running around, you see those computers open in their car all the time. We have those same computers in our vans. So that information that they're getting is the same information that we're getting about, excuse me, about what calls are coming in. So we dispatch from there. Yeah.
One more question. I was walking my dog down by the expressway.
Mhm.
And there's a number of people that's not homeless, but they're kind of living in vans and stuff down there. And as I was walking, some poor he was yelling, shouting obscenities to the world in general, how in the mood basically. Didn't know what to do. I just ignored it. Should I have called in?
You can certainly call. We are happy to go out and respond to any call that we get and see if we can meet up with the person, find out what's going on for them, try to assess whether or not it's a substance use issue, if it's a behavioral health issue, if it's a combination of the two, and then what level of support that they would like to receive from us. Because that's the important part of our service, is it's voluntary. The only time it becomes involuntary is if somebody's being dangerous to themselves or someone else. But otherwise, we show up at people's houses, we knock on their doors, and they tell us where we can go. So we show up places where you make a call like that, we would go down, and maybe by the time we got there, they had wandered off to somewhere else, and so we can't find them. It really varies, but our service, the base of our service is that it is voluntary. Although we do make a good concerted effort to engage folks to the best of our ability. Even sometimes when they're not saying anything, or they're not engaging, or they're sort of in their own space, maybe because of, like I said, substance use disorder or anything else they may be experiencing. We still try to continue. We don't just show up and like, oh, you don't want to talk to us? Okay, bye, I'll see you later. We really try to sit with them, try to engage a little bit, see what it is that they need if they're willing. And then ultimately we do respect that everybody has the right to say no thanks.
Thank you.
Yeah.
Thank you so much.
Yeah. I leave you in a very capable hands, Brittany, to tell you about the wonderful component that we're excited to come on.
Yes.
Thank you.
Yeah, you're all set, Brittany. Thank you so much.
Sorry.
Yeah, no worries. So